Okay. Dr. Goroff, if you're ready, you want to get started?
Sure, but please call me Nancy.
Oh, okay. Well, hello to everyone again, and welcome back for another In Conversation. Tonight, our guest, Dr. Nancy University, who is running in our district's Democratic primary. She's the last of our interviews of primary candidates before June's election, but she's also going to be participating in Saturday County Progressive Coalition Forum, which is going to see the breakout rooms. I had a little bit of help planning that with Dr. James Birch, and so that we also have information on our Facebook page. So if you're not a member of the EEAN Action Network, I encourage you to join. We have a newsletter that goes out we have a Facebook page that is secret, but we're willing to welcome everybody in. We keep it secret because it's just nice for us to talk freely amongst each other and not have to worry about outside meanness. We found that it's been a nice place for us to connect and create dialogue. So again, thank you for joining us tonight, Nancy. I appreciate it. I like to start all of these interviews off with the same question, which is what sparked your interest in public service? Was there an influential person or event in your life that made you think more deeply about the role of government and service to your community?
Thank you, Rebecca. You know, I have been politically active and engaged my whole life. My mother, my uncle were both very politically active, and so one of my earliest memories is as a 5-year-old watching Watergate hearings, not really knowing what they were about. And the first campaign I worked on was when I was 12 years old. So experiment and civic engagement has just been part of my life forever. I've, of course, spent my career in public service at the university, teaching students, doing research, working to make the university a better place, and working to help. I've decided now is that being an advocate on specific issues that I care about. You know, I've also been a member of the Union of Concerned Scientists. I've been very involved as a supporter of Planned Parenthood. Advocating on specific issues just didn't feel like enough anymore in this moment. It felt much more like I need to put my full effort in. I was so frustrated in the run-up to the 2018 election, hearing the rhetoric from the Republicans, from Zeldin and Trump, about how there was this caravan of people, you know, who were coming to invade our country. I'm sure you all remember the ridiculous rhetoric and racist rhetoric of the caravan. But climate change is no big deal. And I felt like there was a complete mismatch between the real problems we face as a country that really need solutions and these diversionary things that they were focusing on. And I decided I had to jump in and put my full effort into trying to make a change on that.
Yeah, I want to dive more deeply into that a little later in the interview, specifically how you as a scientist are combating all of the lies and nonfiction and fiction out there. But first, a lot of the questions that people sent in had to do with wanting to know a little bit just more about you. Where were you born? How did you end up here? So maybe if you could tell us a little bit more about that. How'd you find your way to Long Island? And again, I just want to remind everyone to please mute themselves. We're getting a little bit of background noise. It just makes the interview more easy to hear. Thank you.
So I was born in Chicago and lived there until I went to college. I came to Stony Brook after graduate school and after doing a postdoc. I've lived in Boston, in Los Angeles, in Michigan, and I've been in Stony Brook for 23 years. It's the longest I've lived anywhere. I raised my daughters here and sent them through the public schools here. So Long Island is my home. I came here, as many people at the university do, because it was the best opportunity for me academically to do the research I wanted to do and also interact with students. And I love Stony Brook as a university because it is both a top-notch research university, world-class, and a wonderful engine of social and economic mobility for our students. We have been shown to be one of the strongest schools for social and economic mobility in the country. And that's something I'm very, very proud of. It means that we get students from all different backgrounds, all different walks of life, and all different family experiences. And they are able to get a really excellent education and use them very well, which has been, one of my favorite things about the university.
Why did you become a scientist, and what was your area of study when you came out of school?
So I'm a chemist. I was chair of the chemistry department until I stepped down to make this run. And my research is on making new materials for solar energy. And so I'm an organic chemist. I work with carbon-based molecules, but to make new materials.
Oh, that's super interesting. And my next question actually you just answered. So was it that, did you have to leave your job in order to launch this campaign?
Yeah, officially I've taken a leave of absence, but I stepped down as chair and I'm working on this full time.
I know you mentioned some frustration surrounding the 2016 election, but was there more of a specific impetus for you to launch your campaign, make the decision for you to run?
So what I mentioned was from the 2018 election, but of course the 2016 election was heartrending for all of us. As I said, I felt that I really needed to put my full effort into this. I have been very proud of the work I've done at the university, helping students build a better life, helping the university be a better place. I've been associate provost and interim dean of the graduate school, and then chair of the chemistry department, and still lead my own research lab in my spare time now. But the problems that we face, and especially the willingness to ignore the facts and ignore the evidence on issue after issue, from climate change to healthcare to gun safety, reproductive rights, all of those things, I couldn't take it anymore. I decided I needed to get in there and make a difference.
And is that why you chose the congressional race as your foray into politics? Because you felt you would have the widest reach? For somebody, you've never held political office, and so why this race?
It is very much because the issues where I think I can have the biggest impact are issues that are congressional issues. Climate change is certainly top among those. Now, of course, COVID-19 is an issue we did not have on our horizon back in 2018 when I started talking to people about this race. But it is another issue where I think I can have major impact as a scientist. Healthcare more broadly is something where we need more people with scientific backgrounds to help with analyzing the facts, making sure that Congress has access to the best information available.
Tell us a little bit about your team. So about your campaign, who works with you and how are you leveraging their strengths to help you win the primary?
That's a fantastic question. I have a wonderful team. I'm very proud to have been endorsed by both Emily's List and 314 Action. Emily's List is the premier organization in this country for getting more pro-choice women elected to public office. And 314 Action is modeled after Emily's List, and they are focused on getting more scientists elected to public office. And they helped me from the beginning, before I even had announced my campaign, by helping me get set up with a really professional team of consultants, which we need in this effort, as well as staff members. And so I have a really top-notch team, which has allowed us to get off the ground very, very quickly. We were able to raise the money that we need in order to run a competitive race. And the response has been really just outstanding. I think this is a moment when people are looking to scientists to take leadership. And so our message is resonating very well.
I'll tell you, I think like a lot of people in this quarantine right now, my wife and I have been watching a lot of TV, and we've seen a lot of your ads pop up on Hulu. Not an inexpensive feat. So tell us about that camp that you're raising money. What types of donations are you receiving? What's the average size of your donations?
So I don't have the average size or the exact numbers right now. I can give you numbers from a few weeks ago that about 80 or 85% of our contributions are for $200 or less. We have over 5,000 individual donors who have donated. It's really been a very broad response. People are just very enthusiastic. If I'm elected, I'll be the first female PhD scientist ever to serve in Congress. And that's something that people find really motivating, especially at this moment. And with this administration, people are so frustrated at Trump's willingness to ignore facts and ignore the evidence. And Zeldin, of course, is one of Trump's biggest enablers. And so the opportunity to replace Zeldin with a scientist is something that people are really excited about. And we've been just so thrilled at the response. Altogether, we've raised over $1.3 million, which is considerably more than either of my primary candidate opponents.
Yeah, it's impressive. Let's talk about endorsements. Who's endorsing you and whose endorsements are you going after?
So I mentioned already Emily's List and 314 Action. I've also been endorsed by the National Organization for Women and the National Institute for Reproductive Health. Very proud of those endorsements. I think all of them indicate the strength of our campaign and that these organizations think I'm the one that can beat Lee Zeldin. Locally, I've been endorsed by many leaders in Brookhaven, including Kara Hahn, who's the Deputy Presiding Officer of the County Legislature, Kate Browning, who was second to Perry Gershon last time in the primary, as well as many others. And I've also been endorsed by 4 members of Congress, Bill Foster, Jan Schakowsky, Lois Frankel, and Jerry McNierney. And so I'm very proud of all of those endorsements.
That's wonderful. Congratulations.
Thank you.
Let's talk about relatability. So CD1, New York CD1 is a pretty diverse district with a lot of different types and demographics. What are you doing to make yourself both accessible and relatable to people throughout the entire district?
So, of course, now we're in the time of COVID-19 where accessibility looks different from how it would look in a typical campaign or the way it looked before this. Last year, I spent a lot of time knocking on doors, helping our candidates in Brookhaven and in Smithtown to run, and walked in all different neighborhoods. But what you have to understand is that these are neighborhoods where my students come from, right? It's not like Stony Brook is some place off on a hill. We get our students from all through the district, and every person in the district has a connection to Stony Brook. They have a friend or a neighbor or a child who went through Stony Brook and whose life is better because of it. And so what we have found is that people throughout the district respond very positively. Let me just tell you one story about, I went to the Center Reach Civic Association, which is not exactly a liberal hotbed. And I was just there to listen. This was last May. I was still chair of the chemistry department. I hadn't yet announced my run. So I was just there to listen. And as they were talking about problems with the opioid epidemic and other challenges that their businesses face, a gentleman piped up and said, well, you know, my grandson is a student at Stony Brook, and he's getting a fantastic education there. And we should be doing more to make sure that our students, I don't actually remember everything else he said after that, but as soon as I heard, you know, my grandson's a student at Stony Brook in chemistry, so I went over and introduced myself to him, and he was so excited that a professor from chemistry at Stony Brook was going to run for Congress. he tried to convince me to become a Republican because he's a Republican committeeman and he wanted to introduce me to all his Republican friends. But he was very, very excited that I was running. And last week when we had our chemistry convocation, I was able to, his grandson was graduating, and I was able to send him a message saying, please say hello to your grandfather Mario for me. And he promised he would. I don't think that accessibility is the issue. I think it's making sure people know who I am, and that's what we're working on.
So let's go back to what we touched on a little bit, which some of the misinformation. I mean, in an age of such divisiveness, which notably comes from a lot of misinformation, what skill sets do you bring that can help galvanize not just our district, but a divided Congress should you, win the primary and then the general election?
Yeah, this is just so important. The polarization is terrible, and of course, a lot of it does come from misinformation. And so I think the most important thing we can do is make sure that people have access to the right information, that members of Congress in particular have access to the best information available. And that's something that I plan to do. My skills include being very used to communicating complex ideas to people, whether or not they're enthusiastic about learning those ideas. And I've been very privileged to be part of the Alan Alda Center for Communicating Science at Stony Brook. I think it is important that we give people an opportunity to ask questions and learn, and that applies equally to members of Congress as to students in chemistry classes. So I intend, when I am in Congress, to be a resource for members of Congress from both sides of the aisle, to make sure that they do have access to the information, that they can ask the questions and get their questions answered, and to make sure that they are actually that they are forced to actually take action on things like climate change and hold their feet to the fire on that.
I want to talk more about issues like climate change, but before we do, I want to throw out one other question, which I kind of like to ask people, so broadly as it pertains to Democrats and elections, there seems to be a group who likes a more sensible, middle-of-the-road candidate that perhaps could appeal to moderate Republicans, and then you have another group who wants, a real liberal, progressive Democrat that perhaps could energize the base more. What kind of Democrat do you think will win elections in 2020?
I think a scientist will win election in 2020. And the reason I think a scientist will is because all of the information we have, both from polling and anecdotally from talking to voters, is that a scientist like me can get both of those groups excited, right? To win against Lee Zeldin, we need our base to turn out very actively, like they did in 2018. We also need those middle votes, the people who voted for Zeldin against Perry Gershon, but also voted for Cuomo and Gillibrand in that election, right? In 2018, when Zeldin beat Perry, Cuomo and Gillibrand both won their elections in this district. And so we need those voters to quit. And what we have seen is that the active base is very excited about the opportunity to have a scientist represent them, because they know that I will take action on the issues that they care about, whether it's climate change, healthcare, getting us out of this pandemic crisis. At the same time, the people in the middle are frustrated with what they see as too much partisanship and too much partisan rhetoric. And Zeldin, of course, is the poster child for such partisanship now, because he has tied himself so tightly to Trump. A scientist, on the other hand, they see as outside that partisan wrangling, because they know that some are trained to look at all of the information, come into things with an open mind, and take action based on what the facts and evidence say. So I would say that we have a unique opportunity and very much the strongest message to put up against Zeldin.
Let's talk about some of those issues, okay? I know I say this during all of our interviews. Everybody watching, please take a look at the surveys that Peer did. They were very thorough, they were very extensive, and they're all on their Facebook page under files. But while I have you here now, Nancy, let's use support creating good paying jobs for Long Island and creating more opportunities right here in Suffolk County. What does that look like specifically, and how do we get it done?
Yeah, I think we have a tremendous opportunity right now because we have, of course, the worst economic crisis and the worst public health crisis that any of us have experienced in our lifetime. At the same time, that means we are going to have a lot of federal investment. We need to make the economy work. And we need to make sure that that investment is moving us towards a future we want to have. So we need to be investing in clean energy infrastructure here in particular. Our infrastructure is very much wanting, and we need to make sure that we are investing broadly in infrastructure and specifically in things that make renewable energy and public transportation and clean buildings more accessible for people. And so those are areas where I think we have great opportunity to create jobs here. We also, the largest employers in our district are Stony Brook University and Brookhaven National Lab. And we want to make sure that we're investing in research as a country to move us towards a better clean energy future and to move us towards solutions to problems like the COVID-19 pandemic. Those will also create great jobs here.
Do you have any ideas for sustainable energy products? I know you mentioned you were very involved in that, creating actual materials. Could you give us some specifics as to what that would actually look like, particularly with the unique position we're in here on Long Island?
Yeah, sure. So, I mean, the obvious one, which is already underway, and we need to make sure it continues, is offshore wind. We need to make sure we have the wind energy, which will help our economy in so many ways. We also should be making it easier to have solar energy. There are some both financial ways that the federal government can help, as well as help with infrastructure for that. And we need to be investing in research for things like energy storage, batteries. So right now at Stony Brook, in the department where I was chair, we have 2 Energy Frontiers research centers that are funded by the Department of Energy to develop better battery materials. And that's going to be a very important part of moving to fully renewable energy sources, because we need, the sun does not shine all the time, the wind does not blow all of the time, and we need to be, more importantly than that, demand doesn't stay constant all the time. And so we need batteries to be able to smooth out the energy use to match the demand, as well as to hold energy from when the sun isn't shining. And that will provide great job opportunities here as well in production of those things as they are developed.
How about in addition to sustainable energy, how do you stimulate our jobs market, not only for workers, but for small business owners, especially after this pandemic?
Yeah, this is a great question. They've made some attempts so far. The PPP program, the Payroll Protection Program, was a good first step with certainly some major problems in how it was implemented to begin with. But it doesn't solve all of the problems. The time span over which businesses were expected to spend the money that they got weeks long. And that's because I think they thought that this was going to be a short dip, that we were going to be home for 2 months and then we'd all be back to normal. And we now know that that's not true. So we're going to have to develop new plans and new programs, especially for businesses like restaurants or theaters that cannot open in the near term, right? So we're going to have to really go back. We also, of course, need aid for the state and for municipalities because their revenues have dropped tremendously and their costs have increased because of the pandemic. And the federal government has to help with that. I think it's appalling that Lee Zeldin has voted against aid for the states when New York needs that money so desperately.
Do you think that there's a place for private-public partnerships to help redevelop the economy? If so, what do you think that would look like specifically, and how would you facilitate those partnerships as our Congresswoman?
So I do believe that public-private partnerships can be a good thing, but I think we have to be careful about, very careful about how they're structured. I think, unfortunately, sometimes the private-public partnerships are structured in a way that the taxpayers pay and the private companies get the profits. On the other hand, if you look at things like government investment in research, which is then privately developed into products, things like Google and Apple and Intel have all benefited tremendously, and have the wealth behind in those companies comes largely from government investment in research. And so that is a way that we can have a taxpayer investment that pays off very well for our economy. We need to make sure, again, that the taxpayers are getting their benefit back from it.
Before we move on, we talked a little bit about some specifics for environmental solutions for Long Island, but maybe just as a broader question, if you could just touch on the convergence of climate change in the economy. Sometimes disasters open doors to opportunities, and I'm wondering what, if any, opportunity you see in the wake of our changing environment.
Yeah, as I mentioned, I think that so of course we're in the middle of the disaster pandemic. It's a terrible crisis. It will be done in a couple of years. We will have moved on from this. We don't know exactly how long. Climate change is going to be with us for decades unless we take really ambitious, concerted action very soon. The fact that we are going to need to get out of the economic crisis we're in now, we're going to need significant federal investment, means we have an opportunity to make some decisions. Politicians don't like to make decisions and choose winners and losers, but we are going to have to make some decisions about where we are investing. I think it's very important to look at federal spending as investment and think about what sort of future we want. And one aspect of the future that we must have is an increase in the amount of clean energy we're using, and a decrease, a very rapid, great decrease in the amount of fossil fuels we're using. And so that means that federal investment should be spent in a way that makes that easier.
I'm interested to know too, as a scientist, what you think of hydraulic fracturing and nuclear energy development, two issues that are really relevant to our state.
Yes, so hydraulic fracturing or fracking is really problematic. And it's problematic because people have heard, I'm sure, about concerns with potential contamination of groundwater, potential increases in earthquakes. Those are certainly concerns. Another major concern is release of methane, which is the most potent greenhouse gas we have. And so we need to be able to protect against all of those challenges. That means that fracking needs to be curtailed in the long run. And I think we should not be moving in a way to make it easier for companies to invest in fracking because of the environmental and climate repercussions. Nuclear energy is very complicated, and as a scientist, again, I always want to look at the facts and the evidence. And with nuclear energy, it's a mixed story. There is certainly the danger of major catastrophes, as we have seen with 3 Mile Island, with Chernobyl, with Fukushima. I am told by experts in this area that it is possible to build nuclear energy sources that are much, much safer. And there are new technologies coming out that are much smaller and have greatly reduced risks. We need to invest in research in those areas to see whether it's promising, because if we can use nuclear energy in a way that is safe and environmentally safe, it has tremendous potential benefit for the climate because it is a carbon-free source of energy. That does not mean we're ready to start building more nuclear plants tomorrow, but it does mean we should be looking seriously at that as part of the answer to the puzzle, because burning fossil fuels, whether it's natural gas or coal, is not going to work for us in the long term.
I'm also interested in your scientific perspective on the lies and the misinformation. Again, like you said, your whole career is facts, evidence, hard science. We have a congressman who seems to disregard all of it. If you emerge from the primary as the winner, how do you plan to run against somebody like Lee Zeldin in the general election?
Yeah, we will force him to answer for his record, first of all, because his voting is very extreme and completely outside the areas that are popular in this district. You know, he is voting against the interests of the constituents here, and he's voting against popular opinion here on so many issues. You know, voting to repeal the Affordable Care Act every time he had an opportunity, an A rating from the NRA, a 10% career voting score from the League of Concerned Voters, not to mention his vote against the SALT tax deduction, and not to mention his vote against the HEROES Act, which would bring needed money to Long Island. Certainly, first and foremost, make him accountable for his positions. He has always been an extreme member of Congress, but he used to pretend he was a moderate. He used to play a moderate on TV. And we will make sure people know that he is not a moderate. We will also make sure that people see his partisanship for what it is, and the contrast between me as a scientist, willing to listen to people from any position, willing to hear the information they have, the evidence they have, and come into things with an open mind, compared to his just rank partisanship and willingness to cheerlead for Donald Trump. I think will be a very, very strong contrast, and we look forward to having that discussion.
It's so interesting because he seems to get away with it, and it seems to ignite his base. Especially during this pandemic, there seems to be people who are prone, if not eager, to really disregard facts and opinions. So how do you get to that place that you're talking about where facts become facts again?
So I think you're right. There is a group that is like that. I don't think we should blow it out of proportion how many people are in that group. You know, there was the protest in Comac that many of us found very disturbing. There were a couple hundred people there at the first one, and the second one, from what I read, had even fewer people, and it was drawing from all of Long Island, 3 million people. So let's not let them have the narrative that they are representing public opinion. I don't believe they are. All of the data that we have seen is that the vast majority of people in this district believe that COVID-19 is real and dangerous. They know people who have had it. They often know people who have had very serious outcomes because of it, and perhaps they've lost a loved one. And so I don't think we should exaggerate here in our district how much of that argument of that masks are somehow a subversion of liberty or something, that's the popular opinion here. There are obviously Trump supporters here, and those Trump supporters are going to vote for Zeldin. He's made sure of that. But what we've seen is that they are in the minority now, and that many people who were looking for change in 2016 and so voted for the president now are having buyer's remorse because this is not the change that they had in mind.
Yeah, I hope you're right. So let's talk about the pandemic. What do you think of the governor's response so far, and what are your thoughts about reopening the economy here on Long Island?
So Governor Cuomo has done something which Donald Trump has not, which is that he's been willing to look at the facts, recognize that this is a serious problem, say to the people of New York and now the people of the whole country, because I have friends across the country who tell me that they listen to his press conferences every day. Tell people the bad news and the good news, right? He became more popular than he's ever been before when he was telling people the worst news, but they knew he was telling the truth. He has not been perfect in this pandemic. I'm very concerned about what I've heard about nursing homes and COVID-19 patients being released from hospitals into vulnerable populations in nursing homes. And I think he was very slow to respond to that and too fast to blame nursing room workers for the spread of COVID-19 in nursing homes instead of blaming patients who've been released from hospitals. So those are things that I think need to be addressed. But he has shown the power of listening to the experts, harnessing the facts and the data, and making decisions based on evidence. And that is just such a huge contrast. At the same time, we need the federal government to be taking meaningful action. We need the federal government to be coordinating things. It should not be up to every state to figure out a testing protocol and a testing policy. It should not be up to every state to figure out where to source their personal protective equipment to make sure there's sufficient supplies for the hospitals. It should not be up to figure out where to source their tests. The federal government has completely abdicated on its responsibility to protect the general welfare, and we must do better than that.
Do you have any insights as to containing the virus or thoughts about a realistic timeline for a vaccine?
You know, this is not good ones, not ones that I would want to put in writing. There's so many unknowns still. What I have seen is that as the outbreak has continued, the medical experts have learned more and more about how to effectively treat the disease, right? So it's already less deadly than it was before. They learned pretty quickly on that we don't want to use incubators from the beginning. At the beginning, remember, there was all this discussion about how we needed more incubators, and you haven't heard any of that recently. That's not only because the number of patients has gone down, but also because they found that putting patients on incubators too soon was unhelpful.
Intubators or incubators?
I'm sorry, intubators.
I think we knew what you meant.
Yes. Ventilators.
Ventilators. Yes.
Yes. My apologies. That is not the first time I've made that mistake, but ventilators. Thank you for correcting me. We're the campaign of facts and reality. We want to get these things right. Ventilators. Yes. We were hearing lots about ventilators. Thank you so much. Mm-hmm. And we're not hearing that anymore because the ventilators are not helpful at the beginning. They're only helpful for patients who are at the most dangerous part of the disease. And putting patients on too early had negative effects. We now have remdesivir that is helping. We know that hydroxychloroquine, yeah. And obviously, it's too late at night for me.
And we've just been hearing it all.
As a chemist, I should be able to pronounce these things. Is not helpful, right? The evidence shows that hydroxychloroquine is not helpful. And they're learning more and more about what does work. If the disease were to become significantly less deadly and we could keep the harmful effects from it moderated, that would change the economic calculations and the public health calculations. it seems it's going to be a while before we have a vaccine, not only that works, but that can be produced in amounts sufficient to get it distributed. And there are always challenges with distributing any vaccine. Perhaps in this case, people will be more eager to have the vaccine once it's been shown to be safe. But that's not going to be this fall, it seems. It's going to be at least next year from what we've been reading. I don't have a crystal ball. I think it's important that we continue to do the science to move things forward. And at the same time, we think about ways that we can get people back to work safely and get people back into the economy safely by changing what we're doing and changing how we're interacting with people. But for some parts of our economy, like the entertainment industry and restaurants, it's going to be a long road, and we're going to have to think of ways to help those industries.
So I want to wrap up because I know that we have some viewer questions, and I've already gone past my half-hour allotment for my questions. But before we do, I want to ask, as a woman in a male-dominated industry and as a woman running for public office, if you've encountered misogyny, and if so, could you give us an example of what it was and how you handled it?
I have certainly in my career encountered misogyny, but I don't know if it's so helpful to focus on that. I mean, I had the experience of going to a professional conference. I was literally the only woman there. And I was, I think, 29 years old at the time. And that was because I went to a conference in another country where there were other foreigners, but it was an international conference, but I was actually the only woman there. So I'm not afraid of being one of a few women, or it doesn't keep me from saying my piece. I think.
Are you a feminist, Nancy?
I would say yes, I am a feminist. And by that, I mean, I believe in the importance of standing up for women and women's concerns. I have seen at universities how things have changed as more and more women have become faculty, especially in the sciences, that assumptions about how we do things have shifted. When I was a graduate student, the main chemistry seminar in my department for organic chemistry was held in the evenings, starting at 7:30 at night. It was a terrible time for many people, but it wasn't until there were more women in the department as faculty who had children that they wanted to get home to, and men who were expected to share the child rearing with their wives, that they stopped having those evening seminars. And made it easier for people to participate. There are many ways that having a diverse group of people making decisions makes things better. So whether that's women and men, scientists and lawyers and politicians, or people of color and Caucasians, people of various religions, I think it's very important that we have a diverse body making legislation, because we need all of those voices. I have seen at Stony Brook over and over again that having an inclusive group of people making those decisions leads to better decisions. You get better outcomes because you've considered all those different points of view at the beginning, instead of assuming what is going to be good for people who don't have a voice at the table.
I think that's a great segue into expanding this conversation to the people that are watching, so we can get a broader range of voices. So we've had some come in over the chat here. I don't know if you can see them too. Jim McDonald asks, last week, even before Memorial Day, Zeldin began saying that the economy needs to be reopened. What do you think of these reckless comments?
So I think we have to be very careful about how we talk about this. The economy never closed, right? Certain parts of the economy have closed down, but we need to talk about how we increase economic activity in a safe way. we do not want to get into an argument with Zeldin about, no, the economy should stay closed forever versus the economy should open immediately, because everybody wants the economy to be as open as possible. The problem is we cannot open safely without dealing with the public health crisis. So we have to talk about what steps can we take to get people back to work in a way that is safe and careful and move slowly. And we have to move slowly. At every change we make has to be done carefully, because one of the aspects that makes COVID-19 so challenging is the incubation time between when somebody is exposed and when they can develop symptoms. And of course, we know now that there are people who never develop symptoms. So if we start opening things more, we need to, as Cuomo has put in his plan, I think this is one of the best parts of his plan, we need to make changes and then wait 2 weeks to see what the effects are, and then make more changes. And each of those has to be done step by step. But I don't want to say that the economy should stay closed. The economy isn't closed now. We have all of these people we suddenly recognize are essential workers that we did not perhaps respect in the way we should have before, who have been working all the way through this.
Well, Mike D says the pandemic has made it pretty clear that tying health insurance to employment does not work. Has the crisis moved you towards support some type of Medicare for all system? Read the peer surveys, Mike D, but I'll let you answer now.
So the peer survey was before COVID-19, but and I think it's a fair point and it's a fair question, Mike. So thank you for that. I believe very strongly that every American deserves access to high quality, affordable healthcare, period, full stop. And this pandemic has absolutely laid bare the inequities in our system and the challenges of having employer-based healthcare. In the short term, I think what we need to do is provide people with support to make sure that they have healthcare, whether that's through Medicare whether that's through the exchange, whether that's through payments so that they can maintain their company provided healthcare in the short term. Whatever it is, we need to make sure that right now people have the healthcare they need. In the longer term, we have to figure out how to give everybody access to healthcare, and buying into Medicare, allowing people to buy into Medicare. So having that as a public option seems like a great next step towards moving people to a universal healthcare system. But I am very willing to look at Medicare for all proposals and consider the evidence for and against them. If the unions move in their position, I think that politically this is something that could be doable. But as long as the unions are where they are, I don't think it will be politically doable in the short term to move to a Medicare for all system. But we need to figure out how to get everyone access. I also want to say it's just about the coverage. It's not just about the dollars. It's also about availability, right? And there are many people who live in where they do not have access to healthcare, not only because of the dollars, but because it's just not there. And I think we're going to see tremendous pain and loss in the rural areas as COVID-19 moves across the country because of the lack of hospitals. And we have already seen the disparities in our urban areas in terms of people's general health going into the COVID-19 crisis and how that has affected outcomes. And it is something we must take action on. I'm very hopeful that there will be political will to take that action as a result of the evidence that has come out of the COVID-19 crisis.
Yeah, thank you for mentioning that. Another related question. The more we tend to dismiss Zeldin's supporters as naive and unscientific, which they are, Zeldin will get their votes to win. That was written, that wasn't my opinion, this was written here. Dr. Goroff, as a Republican gentleman, answer answering one of these letters accusing Zeldin of gutting affordable health care, claimed that fining people who do not buy medical insurance is unconstitutional. How will you answer to claims like this?
So the constitutional question has already been answered, not by me, but by the Supreme Court. And they have found that it is completely constitutional to charge people who are not paying for health care, right? That fine is completely allowed. The Republicans have now made that fine equal to $0. And now they are trying to get rid of the Affordable Care Act based on a locality that it can't count as a tax. So the Supreme Court said this fine is a tax. Congress is allowed to pass taxes, so it was fine for Congress to pass the Affordable Care Act. Now we have the Republicans who've made that tax equal to $0, now challenging the Affordable Care Act based on saying it doesn't have any tax in it anymore, and therefore it's not the business of Congress. If that were to succeed in the courts, I think it's a very simple fix. You just reinstate that tax, which is a very important part of making the whole system work. At the same time, we still have 29 million people in this country who do not have health care, and we need to address that issue. So, but if we were to remove the Affordable Care Act, as Zeldin has tried to do, and he has never once offered a positive alternative to the Affordable Care Act, if we were to have that repealed or declared unconstitutional in the courts, 71,000 people in this district would lose access to health care. We need that on it, and I think it's something we can run on. I think they thought they were going to get political points through all of this, and it's not worked out the way they thought, because people really do want to have health care. So the Affordable Care Act is not perfect, and we need to improve on it significantly, but we can't let them just repeal it without replacing it with something else.
I had a few questions come in this week regarding education. This one is from one of our members, Pat Falk. She says, being a retired educator, parent, and grandparent, I want to know your opinion on changing the way our local schools are funded. Wealthier districts are able to have better facilities, materials, opportunities, and experiences for their students, while poorer districts may struggle financially to provide a bare minimum. What would you do to make our school districts and the quality of services they provide students equal and comparable?
Yeah, this is a tremendous challenge, and I do think there's a role for the federal government in here. It makes the problems and the inequities are obvious, right? We have traditionally paid for our education almost entirely from property taxes, and that puts a tremendous burden on working class families, and it also means that in some communities, they do not have the resources to provide the same kind of educational opportunities. I think, again, the COVID-19 crisis has laid those inequities bare, because there are places where people do not have access to internet, they don't have computers at home, and they're not able to get the same kind of instruction as others who have more resources. The federal government needs to play a role here. In particular, we should be increasing funding for Title I programs and Title III programs. So Title I for low-income communities to make sure that they have the funding they need, and Title III for non-native speakers of English to make sure that the resources are there. And if you look at communities like Riverhead, where there are large numbers of immigrants, and there is a significant anti-immigrant feeling for many reasons, but part of it is the burden on the school system to pay for the extra instruction for these non-native speakers of English, and the federal government should be alleviating that as well.
This is a specific question, but I'm going to ask it. With respect to the way this coronavirus has changed how higher education is to be given, What are your suggestions about how students should do lab work and internships online?
Oh, that is a topic very near and dear to my
I
heart.
thought it might be.
So let me just say that at Stony Brook, I had the privilege as associate provost to work on looking at how to make internships as effective as possible and experiential learning in general as effective as possible. There's a lot of research done separate from the question of how to put these things online about what makes these experiential learning opportunities the most effective. What you need to do to have, and these are considered high impact experiences that can really change a student's life. For them to be effective, students need to be really thinking before, during, and after the experience. They have to have opportunity to reflect on what they hope to learn, what they will learn in the experience, what they are learning, and then afterwards think back about what they have learned. They need to have some kind of capstone to put this all together. They have to have clear goals for what they want to learn, and they need to have clear mentorship and regular mentorship or supervision from somebody teaching them and showing them what works. There are many other aspects to this. Some of those are more easily carried over to an online environment than others. We are now wrestling in the chemistry department at Stony Brook, and by we, I mean my colleagues who are still teaching because I am on leave, are wrestling with how to take all of the skills that we typically expect students to learn in a lab environment and translate those into things they can do at home. There are certainly some things you can do, like I have taught classes on the chemistry of cooking, and you can certainly do some you can teach some aspects of lab work through a chemistry of cooking type experience. But some aspects, including questions like measurement and actually how you use the glassware of a chemistry lab, are much more difficult to do because we cannot have students setting up lab setups in their homes. It just would not be safe and it would not be economical. So this is something we're grappling with, and the honest answer is there is no easy answer. Some things will be lost. Hopefully some other life experiences will be gained, which will make this overall still a very valuable experience for the students.
I see the joy on your face when you talk about your students and experiences like this. You could tell that it was something you loved very much. Okay, so another educated related question. As a person who's dedicated all her life to higher education, what are your views on making higher education accessible to students, both traditional high school graduates and older non-traditional employees or maybe homemakers?
Yeah, thank you for including that aspect. I don't know who it was who asked that question, but I think that's very important. Our community colleges do tremendous work with non-traditional students, as well as many students going directly from high school. But they particularly cater to students who cannot be full-time students, and I think that's a hugely important area. We need to make sure that our community colleges maintain sufficient funding to be able to reach all of those students. More broadly, I think public education is incredibly important. As I said at the outset, I am very proud of Stony Brook for being an engine of social and economic mobility, and that is largely because the university is relatively affordable. It's relatively affordable now because New York has done relatively well in investing in its universities. We would certainly like to see a greater investment, but compared to schools like Vermont and New Hampshire, which instead use a model based on very high tuitions, it has done a much better job. My concern with moving to some kind of model like what Bernie Sanders suggested of making public education just completely free for people is the devil's in the details. So what Sanders suggested was that we should pay for whatever the previous tuition was, the federal government should cover that. And that ignores the difference in investment of taxpayer money that comes from different states. And so I would be very opposed to them that led to Vermont and New Hampshire getting many more dollars from the federal government per student than a state like New York, but we also have to worry about states where they have neither invested their own money nor charged high tuition, and they just are really under-resourced. So this is a really complicated question where we have to look at the details to figure out a plan that will work.
Okay, this one comes from Bernie Buddha. Nancy's TV ads have one consistent message, and that is that we need a scientist to represent us because the coronavirus crisis has shown need more scientists in Congress. Nancy's credentials and scientific accomplishments are notable and impressive. However, I think our congressperson needs more than scientific knowledge to be an effective legislator. Can she help me better understand how, if elected, she expects to get things done in Washington? I'm having a hard time bridging the gap from her background to all the needs that we have here on Long Island.
Certainly. So I do think that as a scientist, I bring unique skills that we do need to see in Congress. And I'm happy to talk more about that, and I will in just a minute. But first, I want to also emphasize that I have held other positions at the university that I think give me skills that are particularly valuable here. So I mentioned being associate provost and interim dean and then chair of the chemistry department. Just to relate one story to you, when I was first associate provost, and it continued on after that, we identified a group of researchers at the university who were not eligible for health care. The reasons are a little bit complicated, but they were on fellowship and therefore not considered employees, and therefore had no way to purchase health care except by going to the Obamacare exchange. We were able to convince the university and the SUNY system more broadly that these workers, these researchers deserved healthcare, and that the system has been changed now as a result of the actions that my office took in collaboration with people from other universities. We formed a task force to look at this. We found the solutions that other universities were using in other states, and we were able to convince SUNY that they should make the change to cover these researchers. So that's one example where we found a problem. So it was my office that identified the problem. We figured out solutions, and we brought those solutions to the Research Foundation of SUNY to be able to make the change to get people healthcare that they needed. More generally, as a scientist, I think we have many lawyers, we have many business people in Congress right now. There is a tremendous lack of understanding of technical information. So there is currently one PhD scientist in Congress, Bill Foster, and I'm very proud to have his endorsement. Bill Foster tells his supporters that they should help me get elected because it'll cut his workload in half, because he spends so much time helping the other members of Congress understand the technical information that is part of issues, whether we're talking about the Iran nuclear deal, we're talking about pharmaceutical drug prices, we're talking about climate change. On issue after issue, there's tremendous technical information, and there's evidence coming from many different sources. So I'll give you one more story. When I was, a few years ago, I was getting into Facebook discussions with a friend about climate change. And he kept coming up with new videos that showed that climate change wasn't real. And I kept looking at them and finding the fallacies in their data analysis for him and explaining to him why the graph they were showing made no sense, not only made no sense, but was really a cherry picking of data. So they would, for example, pick 1998 as one year, and then 2012 as the comparison year, and say, look, the temperature in 2012 is only slightly higher than in 1998. But 1998 was the warmest year. I think it's 1998. I might have the exact year wrong. But 1998 was the warmest year in that decade, and 2012 was the coolest year of the years around it. And they had cherry-picked these two to pretend that there hadn't been much warming between one and another. And that was something that I was able to see very quickly, but my friend was not able to see until I pointed it out to him. That's the example. That's an example of why we need people who are used to looking at quantitative information and can analyze it. We need that in Congress. I hope that helps.
Okay. We're a little past our time here, but I have a few more questions, so I'm going to ask them. This one jumps back to the pandemic. In January, instead of focusing on the need for more testing, Trump implemented a ban on travel from China to stop the spread. Do you think this actually did anything?
I think that's the wrong question. Yes, I think something, and it probably had some positive effect. At the same time, we now know that most of the cases in New York originated from virus that came from Europe, not from China. So did it do something? Yes, it probably did something because it reduced the amount of travel of people who were infected. At the same time, he did not do all the other things that should have been done. He did not make sure we had sufficient supplies of personal protective equipment. That was an obvious one that should be done. He did not make sure that we had a functioning test and that we had sufficient supplies and a plan for how to test people, how to do contact tracing, and quarantine people who had been affected. He did not face the facts that this was coming here and mobilize his administration to take action, to mobilize the FDA to work with manufacturers to make more testing supplies, to mobilize the CDC to work with suppliers for personal protective equipment. There are so many things that they didn't do. They didn't even look for community spread of the disease, even though there was already evidence from other countries that communities are real. They chose only to test people who had a known connection through travel to China and then to Italy. And so they completely missed the community spread until it was unavoidable. It was clear that it had been happening. But they chose not to look for it. So that travel ban had some positive effect, and it was in the middle of many, many choices that they made that had very negative effects. It is very clear this did not have to be so bad here. There's a reason that the United States has the most fatalities of any country in the world. And there's a reason that the United States and Brazil are the countries with the most cases. And it's because in both cases, the leaders decided to ignore the pandemic, ignore the facts and evidence, pretend it was going to go away, pretend it was all going to be a miracle, blame it on China instead of actually making meaningful changes. And as a result, it has been much worse than it needed to be.
All right, let's end on two fun ones. What do you say?
Something lighter than that.
Yeah. What does Dr. Goroff do for fun? What hobbies does she have? What are her interests outside of work?
Thank you. I am a chemist, and so I'm a baker. I love baking. I mentioned that I've taught courses on the chemistry of cooking, which is one of my favorite things to teach. I've given public lectures on it. I think there's one still on a chemist cooks Thanksgiving dinner. But the overlap between chemistry and cooking is one of my favorite areas. My daughter has a t-shirt that sums it up well. It says, "Baking is science for hungry people." And so I've always loved baking. We have been baking sourdough bread since 2011. So not just in the pandemic, but certainly it's been fun to share notes with people during the pandemic on sourdough baking. I also love kayaking and hiking and during the pandemic, taking walks has been an incredible release. It's been fantastic for both physical and mental health for me and my husband. So those are some of the things that we enjoy doing.
Lovely. So tell us, what's your favorite moment been on the campaign, and are you having a good time? I mean, you're running for office.
I am having a fantastic time. Favorite moment? That's a great question. You know, I think we've had so many moments with the campaign staff. I love sharing the joys and sometimes the moments that are less joyful with them. It's been really fantastic. I have such an enthusiastic group of people working with me, and meeting volunteers has been fantastic. Meeting people when I was knocking on doors was wonderful. And it's just, the response has been so positive. People are so excited about getting to elect the first female PhD scientist ever to Congress. The response has been wonderful. And so I've been having a great time every day since we started last July.
That's wonderful. Well, thank you for being with us tonight. And should you come out of the primary as the winner, our group, EEAN Action Network, would love to know what we could do more to help you. So please, let's keep in touch.
Fantastic.
If anybody else has any more questions, how can they reach you?
So they are very welcome to email me at nancy@goroffforcongress.com. Very happy to get your emails, get your thoughts. Very happy to have people join our group. We have over 200 volunteers.